Hi, everyone, and welcome to our Ask the Expert session, specifically focused on Medicare, Medicaid, and Social Security benefits. Thank you to those of us in MSA Connect who have submitted questions for this. We're going to try our best today to address all of your major themes and questions that came up. I'm so excited to introduce our first speakers from the Social Security Administration. I'm going to let each of them introduce themselves quickly, and then we will jump into our questions.
Thank you, Ella. We are so grateful to be here with you and grateful to everyone viewing our segment here today. My name is Josephine Mueller, and I am a public affairs specialist with the Social Security Administration. And what I do as a public affairs specialist is I share information about Social Security's benefits and programs. But I am not here alone. I am here with my two wonderful colleagues, Mr. Daniel Summer and Mr. Shahzaib Shakeel. And I'm going to pass it over to Mr. Summer so he can introduce himself to you. And then he'll pass it on to our other colleague, Mr. Shakeel.
Thank you, Josephine. I'm Daniel Summer, Public Affairs Specialist Extraordinaire, and I've been explaining information to people for 21 years for the agency. And if you have a question that relates to anything, particularly disability, I go on the road with that tour. But again, there's a third to this three-part public affairs specialist team, and I'm going to let Mr. Shakeel explain to you how he ends up being the master cylinder. Shaz?
Thank you so much, Danny. It's a pleasure to be here with everybody, and thank you for inviting Social Security. So there's a ton that Social Security does, from Medicare to retirement to assigning Social Security numbers to disability benefits, survivor benefits, children's benefits, and sometimes it can be a little overwhelming. So that's where folks like myself, Josephine, and Daniel come into the picture, where part of our job is to share this information with the general public, share this information with our seniors, our disability community, so they know exactly what benefits they could get from Social Security, right? Because a lot of times it seems a little overwhelming. So we're glad to be here today. We're going to do our best to sort of explain some of the more complicated things in plain language, so everybody can kind of understand exactly what Social Security can do for them and have a good understanding of our benefit program. So again, thank you, everybody, and nice to be here.
Thank you all so much. All right, I'm going to jump into our first question for you guys, which is, when someone with multiple system atrophy, when they're diagnosed, when should they begin applying for Social Security disability benefits? And what benefits should they consider soon after
This is
diagnosis?
a great question, Ella, and I'll go ahead and take this question because it's very, very, very important to apply as soon as possible. Now, you may be wondering, okay, well, apply as soon as possible. How do I do that? Well, there are a few ways that you can apply for benefits with us. And the best way to do it is online. So if you visit our website at socialsecurity.gov, you can apply for disability benefits online. You can also give us a call at 1-800-772-1213, where we can go ahead and we can schedule you an appointment and take the application for you right over the phone. But the most important thing that I want everyone to take here is from that question is apply as soon as possible. It is vital that you apply as soon as possible because it can take some time to process the application. Now, my colleague, Mr. Summer here, will talk a little bit about compassionate allowances in his part of the segment, but I want to mention that it's important to give us a call and to start that application right away. And so after that application, I know there was a second piece to that question, Ella, where it says, what should you expect after, right? So a person should expect after they've applied to receive notifications as far as what part of the process they're at in their application. And the best way to keep an eye on the application process is by having a My Social Security account. So if you visit us online on our website and you create a My Social Security account, you're going to be able to see the progress of your application and what stage it's at. You'll also be able to receive the notices. So if there's something that we need from you, you're going to be able to see that right away in your My Social Security account. You will also get paper notices in the mail if you don't have a My Social Security account. So regardless, we will find a way to get that information to you. However, I encourage people to create that My Social Security account so that way they can see their notices immediately and they can follow their application process.
Thank you so much. As you mentioned, we did also get some questions related to compassionate allowance eligibility. And so our next question is kind of around how does the disability application process work for people with MSA, including compassionate allowance eligibility? And if you could just kind of
I like
clarify a little
this
bit
one,
what
so
that
I've got to
is.
steal it from you. The disability process is very similar in most instances, with this particular exception. These cases are automatically flagged. Sometimes a condition is considered so pervasive or severe or serious that they get special processing. This is called compassionate allowance. In other words, it's expedited. Certain parts of the process are truncated and already assumed to be qualified. So we move forward with a faster goal of getting this claim decided. And how does that work? Basically, we want you not to delay when you're applying, because that's always better. Josephine went over just a bit about how you apply online, in person, or via phone. But the most important part is that interview, and this is how the process works. Whether you submit it yourself by answering the questions or we ask them of you over the phone or in person, we want to find out about your actual medical condition, the medications, the places where you've sought treatment, and the type of work activity that you've been doing. All of this will be evaluated because it's going to matter. Ultimately, we get information about your medications and so on, and we send it to the Disability Determination Service. Those are the individuals who are medical professionals who will review those records. In some instances, there's a consultative evaluation, and otherwise, we send you to a doctor because maybe there's not enough information or there's something specific that we need to know before ultimately making the decision. This individual is disabled by our standards or they are not. So that's what we're working toward, and that is the process. If anything happens where, let's just say, a claim is approved, great. We set up the information to try to get you your pay as quickly as possible. After all, that's why we call it a compassionate allowance. However, if it's denied, there is a secondary part of this process and you appeal it. But you must do that within 60 days on the date of the letter saying it was denied. And it goes back to the Disability Determination Service, where a different medical professional or group of them will review it so that it's a fair process to you. It's not Shahzaib sitting up there saying, I said no. It's another opportunity. So you have the right to that appeal and a second one afterward. But that essentially explains the process.
Thank you so much. I know you've just touched on this question already in the answer to that one, but anything any of you would add around the question of, in the disability application process, what documentation is most important and what should someone do if
So
they're
that's
denied?
a great question, Ella. So the disability application process, it's important to understand being disabled versus your disability qualifying you for Social Security benefits, right? Sometimes there's a bit of a difference in what those two things mean. So Social Security disability benefits are designed to replace the income that you're going to lose now because your disability is preventing you from working. So you can no longer earn your salary or earn your wages from your job. So you need to replace that with your Social Security benefits, and that's how you're going to support yourself. So Social Security disability benefits are awarded if your disabling condition is expected to last 12 or more months, but that disabling condition is preventing you from working substantially. That's the important part here. So a disability application, the first important documentation or paperwork that you want to make sure the Social Security folks are aware of is, are you still working or not? Right? Because a lot of times folks will file for disability claims. They might have a diagnosis of a certain condition, but it may not be as severe quite yet. And they're still able to work their 40 hours a week and still earn a substantial amount, right? So in that case, those folks' disability application would technically be denied. Even before we get into the medical evidence portion of it, we would deny your application just based on the non-medical factors, meaning, hey, your disability has not affected your ability to work quite yet because you're still making $2,000, $3,000, $4,000 a month. So if you are working and you become disabled, you've got to first consider, is this disability affecting my ability to work and continue my job, right? If you're not working and you're going to file disability benefits, that work question, that part will be cleared up quicker and easier. But the next documentation and the next set of paperwork that we would need would be your medical evidence, right? So which doctors and hospitals and therapists can we get evidence from that would show us enough evidence and enough proof of your disability, right? So that medical evidence is determined based on several factors, right? We'll look at the relevancy of it. Is it relevant to your condition and your allegation? Is it recent? How recent is the medical evidence that you're providing, right? So that goes into what Josephine was saying, where if you've had a condition diagnosed 5 or 6 years ago and you're applying for those benefits today, and the only evidence we have is from 5 or 6 years ago, that'll make a difference as opposed to somebody who was diagnosed within the last 12 months and is applying immediately, right? So at any of these stages of the application process, there could be delays where the customer doesn't get to us the proper paperwork, right? So all of these are day-to-day things that happen with the disability application process that we'll expand on as we talk more here. But the main paperwork and the main evidence that we would consider or need immediately is, are you still working or not? Let's talk about that. And what is your actual medical condition and what kind of evidence and proofs are we able to get for that?
Awesome. Thank you so much. That's really helpful. Another kind of question about those disability benefits. Do short-term disability or long-term disability benefits through an employer affect when or how someone should apply for Social Security disability or supplemental security
You're just
income?
rolling out the great questions that people need to know today. I appreciate that, Ella. And in fact, this is something that prevents a lot of people not understanding it. It prevents a lot of them for filing timely. When we talk about SSI and disability, sometimes we talk about them like they're one program. And indeed, they are each for individuals who find themselves unable to work substantially due to their disabling impairments. However, they have very different rules that govern each. So when you ask, do short-term or long-term disability benefits affect whether or not a person can get disability, the answer would be for disability as opposed to SSI, no, because you've paid into disability by working. Think of it as an insurance, and your payments are the taxes you pay as you work. And like any good insurer, when something happens, you can collect. It works like unemployment, except for you're disabled instead of losing your job. Now, keep that in mind. When we look at SSI, it's a different kind of program. It is not an insurance and doesn't work like one. In fact, it's public assistance. It's help. Think of SNAP benefits. Okay? If someone has some income, it's still possible that they can be eligible for SNAP, but it depends. If they have a whole lot of money, they might be ineligible, not because they're not disabled, because they meet the medical criteria, but only due to the fact that they have too much income, and this is a needs-based program for people with low income and resources. On the other hand, if you look at the disability, you could scratch off the winning lottery ticket. You still paid into it, and it's still your benefit. Now, sometimes people think that their benefits will mean they can't get disability or SSI, but you can never, ever judge that from the outside because there are many exceptions and income that we screen out and that we exclude. So even for SSI, let's just say you don't get the maximum amount because of your short-term or long-term disability. It is still possible that you may receive a lower amount as long as you receive those short-term or long-term disability benefits. The important part is you come to the Social Security Administration with that question and don't try to discern it because it says if you make more than this or make less than that, you qualify or don't qualify, because for every rule at Social Security, I guarantee you, there are exceptions.
Great, thank you. Yeah, I think that provides a lot of clarity. A similar question, can someone receive Social Security disability benefits while also receiving other benefits, things like VA disability, private disability insurance, or retirement benefits?
So that answer also depends on which type of benefits you're getting from Social Security, right? So Social Security, as Danny mentioned, we have two different Social Security disability programs. So there's Social Security disability, and then there's SSI, or Supplemental Security Income Disability. So the Social Security disability benefits, these are the benefits that are paid to folks who had been working, right? And they were working, paying Social Security taxes, and the plan would have been to keep working until their 60s and draw their Social Security benefits as a retirement check. But because of their disability, they're unable to work that long. So they have to stop working in their 40s or their 50s at some point before their retirement ages, right? So upon approval of their disability and when they have to stop working, those same retirement benefits that they would have had coming at age 67 or 68 or what have you, for all the Social Security taxes that you have been paying up until that point, you're just drawing those same benefits early as a disability check, okay? So those benefits that are based on your earnings that you are due, right, the one that's as an insurance policy, so you can collect those benefits plus collect other benefits as a VA check or a short-term disability or a long-term disability. The other disability program, SSI, or Supplemental Security Income, so again, you still have to qualify for that based on your medical condition, right? You still have to satisfy the definition of Social Security disability, but SSI is a completely different program. So you don't have to work and pay Social Security taxes to qualify for SSI. The way you qualify for SSI is by being disabled, meeting that definition, but then you have to be limited income and limited resources or assets. So SSI is a needs-based program, right? We call it a program of last resort. And in layman's terms, it's a welfare program, right? So it's paid to folks who need that extra income because of their financial situation, that they're very low income and very low resources. So if somebody has other income, meaning a short-term disability check or a VA pension check or income from any other source, it will count against how much you can potentially get in SSI, right? So the SSI benefit amount in 2026 is $994. So anybody on SSI in 2026, the most you can potentially get is $996, assuming you have almost no other income and assets, right? But if you have a $500 check coming from the VA, gonna cut against that $996 that you can potentially get from SSI. So it's not a dollar for dollar reduction, but it's pretty close to that if you kind of want to think about it that way, right? So somebody with a $500 VA pension would not qualify for the full 994 in SSI. You might get 450, 550, somewhere in that ballpark. So other income will affect SSI payments potentially. The other income may not affect your Social Security disability, right? So understanding the difference between the two programs is critical, and that's a common place where folks are sometimes confused and have a lot of questions about that.
Awesome. Thank you. And just to dive a little bit deeper on that discussion about retirement, what happens to Social Security disability benefits when someone reaches retirement age, and how are their payments
That
affected?
is a great question, Ella. And I'm going to take that one because that's an easy one for me. And my colleagues here, they went through the hard stuff already. And I'm just so glad that they distinguished the difference between SSI, Supplemental Security Income, and Social Security Disability. And I want to share with you all here that information is available on our website at socialsecurity.gov. We have some great resources on our website that talk about the SSI program and that talk about Social Security Disability. We have a publication section. So if you go to the bottom of our page and you click on resources, you're going to see that there's a publication section. You can read there's booklets on there that you can read through, ebook. You can even order some. If you want to listen to them via audio, you can listen to that information via audio. It's a really nice resource. So I encourage anyone who is interested in diving deeper or learning more about the two programs to visit us on our website at socialsecurity.gov. Lots of great information, a wealth of information. And so I just wanted to share that before we dive into what happens when somebody is receiving disability benefits and then they turn retirement age. So now maybe they're 62, they've been receiving Social Security disability benefits, say, for example, when they were 40, and then now fast forward, they just turned 62. What happens? And so when somebody's receiving Social Security disability benefits, which are the benefits that my colleagues here spoke about, that we pay into FICA taxes. Those are the benefits that we've paid into. And so then if something were to happen to us, we can collect Social Security disability benefits. If somebody's receiving that benefit, once they turn 62 or 63, 64, 65, 66, 67, at any age, that benefit amount's going to stay the same. Why? Because when somebody receives Social Security disability benefits, even if it's at age 40 or younger than that, if they're receiving Social Security disability benefits, they receive the amount they would have received at full retirement age. And a lot of folks, full retirement age, it's different for each and every one of us. It could be 66. For a lot of folks now, full retirement age is 67. But full retirement age basically means that's when a person's eligible to collect 100% of their benefit. But if you do have a condition that impacted you to where you were unable to work due to the disabling condition, and it's going to last for more than 1 year, and you were approved for disability benefits, even if it was before your full retirement age, you're receiving 100% of your benefit. And once you turn retirement age, your benefit in full retirement age, your benefit stays the same. There are no difference. The only thing that happens with us on our side is the record changes to show at full retirement shows retirement benefits, but the amount stays the same. Now, I do want to mention for SSI, it's a little bit different. My colleagues here talked about SSI, Supplemental Security Income, which is a needs-based program. When somebody's receiving SSI disability benefits, when they turn 62, they would have to apply for their retirement benefit if they're eligible for a retirement benefit through Social Security. And then what would happen is if they start collecting that retirement benefit and it's greater than what they could get off of SSI, then they would then be receiving that benefit. I do want to pass it over to my colleague, Mr. Summer, because I want him to add anything that may be really important and relevant to this question. So, Mr. Summer, I'm going to pass the ball over to you.
Well, with the retirement, and thank you, Josephine, that was very interesting. But I'm also going to let you know that there are people who receive more than one benefit. They can be entitled to that retirement benefit. If it's fairly low, they could still receive some SSI. And sometimes if a person's receiving disability, but they hadn't had a long time to work or pay high earnings into it, they could also receive SSI. So we evaluate that. It's a very important thing that we give the possibility of every benefit. We review what you could potentially be entitled to, and it's our responsibility to do so. I've seen individuals who say, I want this benefit or I want that benefit. I want to apply for disability. And I look at it and I say, well, they don't have enough credit to get disability. But with their impairment, it's possible for them to receive SSI. Or they'll get a disability amount, but we could do a little better by them because they'll get $300 or $400 more each month if we add SSI to that. So we absolutely look for every survivor, every retirement, every SSI, every disability, every potential disabled adult child benefit that we can when you're evaluated, which is why we want you to not just decide, I can get this, I can get that, and so I won't apply for it. Come to us because we must look at the record to make those decisions.
That was awesome. Thank you guys so much for providing some clarity on that. Our last question for you today is going to be around people who live outside of the U.S. So the question we have is, what options exist for people living outside of the U.S. who receive Social Security benefits and later develop a condition like MSA? Are there any additional disability-related benefits or reporting requirements for those folks?
Josie and Danny, I'll give you guys a break. I'll take this one. Now, again, the rules about being outside the U.S. and receiving Social Security benefits, rules are a little different for whether you're getting Social Security disability or you're getting SSI disability. That's the first thing to consider. And then the other thing to consider, is this beneficiary who's living outside the U.S., is this person a U.S. citizen, or are they legally present in the U.S., meaning they have legal present status as a green card, a work authorization card, a visa, are they an asylee or a refugee? So they have some legal status in the U.S. other than U.S. citizen. So generally, for SSI benefits, if you're outside the U.S., SSI benefits are not payable. They would be suspended if you're overseas, right? You've got to be present in the U.S. to receive SSI benefits. Now, Social Security benefits, whether that's Social Security disability, Social Security retirement, Social Security survivor benefits, a U.S. citizen can continue to draw those benefits if they're living overseas, okay? There's obviously reporting requirements about it, meaning you got to make sure we have your correct foreign address. There's other things that might come up, right? So if somebody's living overseas, they haven't used their Medicare in 3 or 4 years, we might send you a letter to make sure you're still alive so we can continue paying you those Social Security benefits. So there are reporting responsibilities that come up in that sense. That's for a U.S. citizen. So a non-U.S. citizen, let's say somebody with a green card or a permanent U.S. resident, right? They are also able to live overseas and continue to collect their Social Security benefits, but they have other reporting requirements that they have to comply with. The big one is if you're a non-U.S. citizen and you're overseas for over 6 months, that 7th month, we might stop your check, where you would have to return to the U.S. either for 30 days or a calendar month so we can resume to pay you, right? So you can't be overseas forever if you're not a U.S. citizen. There are some requirements where you have to report back and fill out some paperwork with your local office, and then we continue your benefits. If there's somebody living overseas, whether they're a U.S. citizen or not, and they feel like they need to apply for Social Security benefits and get it started, we do have federal foreign benefit units overseas in different countries. You can apply online. There is a different process for those folks, right? We do have one particular Office of International Operations out in Baltimore that kind of handles a lot of the work for folks with foreign addresses. But there is stuff to consider. There is stuff to consider. So the main different point would be, again, if you're getting Social Security or whether you're getting SSI, that's the first thing to consider. And then next is, am I a U.S. citizen or not? And depending on that, there's a different set of rules and circumstances to be aware of.
Awesome. Thank you so much. That is the end of our list of questions for you guys, but I just would open the floor if any of you have anything you want to add as far as where you would suggest that people go as they're navigating this diagnosis. Just what are those first steps and what would your advice be?
What I would say first and foremost is you need to be swift and be thorough. So many times people wait because it's a hard pill to swallow to find out that you have a severe condition. And people don't want to acknowledge that, wait, maybe I'm disabled. People often tough it out. But this process is long. You want to be swift to get it started as soon as possible. And you absolutely want to be thorough. In essence, I've had people who come to me and they have a heart attack or some condition. And they say, I had a heart attack. Doc says it can't work. When do I get the disability check? It may be the case. That condition qualifies them. But what if it's not? But they don't tell us about the headaches they never got treated, the bad back that they just deal with, or the bum knee they've had since that high school football game. Being thorough and coming to acknowledge all of the impairments gives the Social Security Administration the best opportunity to look at you in totality and say, this individual won't be able to work with all of this going on. And that's what we want. A one-time, very quick, correct, and accurate decision based on your actual condition. So this is no time to play tough. This is the time to be thorough.
Yeah.
Exactly. And it's also important to remember, so we have different levels of appeal for disability cases, right? So if your case is denied the first time, you don't have to refile a brand new claim. Our second level of appeal, we call the reconsideration, right? Where first time around, maybe your doctor didn't send us all the paperwork that we needed and we couldn't approve the benefits. You file an appeal, we get the correct paperwork this time around. Benefits are approved from the date of the original application, right? Even if the appeal, which is we call a reconsideration, even if that's denied, you're able to take it a step above and file for a hearing request where you can take your case in front of an administrative law judge. And at that point, some folks consider getting an attorney to help them out. But that's a hearing request where you're talking your case out in front of a judge. Even if that doesn't work out, you can even ultimately appeal to federal court if you wanted to. So all of that stuff, again, that's all part of the disability process, right? But for folks with MSA, if the application is done correctly and on time and the right way, it shouldn't be denied the first time, theoretically, right? Because your condition is severe enough to qualify you. That's why it's on one of our compassionate allowances list. The only trouble somebody might have is we're trying to get a signature on an application, or we're trying to confirm your address. We're trying to mail you some paperwork that we need filled out and it never gets to you. So we never get it back and things get caught up in that way. So those are the things that you want to avoid, right? And then the best way to avoid those is just to be, as Danny mentioned, thorough, accurate, timely, and on top of things, right? Because Social Security, we get about 2 million disability applications per year across the country, right? So that's a lot of disability applications. You just want to make sure that your application is as thorough and complete as possible.
Yeah. And Ella, I want to mention something because my colleagues here did an amazing job in explaining the difference between SSI, Social Security disability, being thorough and making sure that you're getting all that information into us. And I want to share that we have a tool so that you can keep track of your application. And I know I mentioned it at the beginning, but I want to mention it here at the end as well, because to my colleague's point, it's important to make sure that we have everything we need in order to process the application and to process it as quickly as possible. And one of the best ways to do that is by creating a My Social Security account. the best way to keep track of your application is having access to your online My Social Security account. And you'll get notices there. So say something happens where the mail doesn't get to you on time, but if you have a My Social Security account, you're going to see that notice in your account. And so very important here for everyone watching this video, this segment here, at any point that you're watching this, it's important to have a My Social Security account. Visit us on our website, socialsecurity.gov. In the upper right corner, it'll say My Account or Sign into My Account. Click there. Once you click there, it's going to give you two options. Sign in with login.gov or create an account with login.gov. It's a blue icon. And the second option is going to be sign in with id.me, the green icon, or create an account with id.me. And that's the green icon. I encourage people to click on the green icon. I let people know green means go because from experience, I've seen that it's a very seamless process in creating a My Social Security account with the green icon. You have the option to choose either one. However, if you come to that page and you see both icons, I encourage you to click on the green one and start creating your account if you don't already have one with id.me. Once you click in there and you start creating your account, you're going to have access to your Social Security business. You will be able to see what your disability monthly benefit amount would be. So even if you don't have an application in yet, you can see what that monthly amount estimated monthly benefit amount would be once you do start to receive Social Security disability benefits. And then there's just so much more that you can do there. Update your address, banking information. So please create that account if you don't already have one, because it is going to be your window to your Social Security world.
Awesome. Thank you all so much. And thank you so much for your very thorough answers to all of these questions. I know that these are really complicated topics and something that can be really difficult to navigate in the middle of dealing with something like MSA. So this is really helpful to get clarity on some of these things. Yeah, we're so grateful for each one of you for being here and for answering our questions.
Thank you, Ella.
Thank you.
And thank you for everyone out there viewing this presentation here. Take care.
Hi, everyone. Welcome to the second part of our Ask the Experts session focused on Medicare, Medicaid, and Social Security benefits. We're so excited to introduce our last speaker of this session, Emily Brown from the Patient Advocate Foundation. And I'm going to pass it over to her to introduce herself a little bit and explain more about what she does.
Thank you, Ella, and thank you for having me today. So, like Ella said, my name is Emily Brown. I am with the Patient Advocate Foundation. We are a national 501c3 organization that helps patients who have chronic, debilitating, and life-threatening illnesses. I have been with the organization almost 13 years now. I started as a case manager and I moved over to the education department about 8 or so years ago. So I write all of our educational materials for the organization. So that is our tip sheets, our webinars, our longer form publications. And really with the goal of our educational materials are really just to help patients understand things like insurance navigation, negotiating medical bills, the disability process, how to choose the right insurance, and all that good stuff. So I do appreciate you allowing me to be here today and share some of that knowledge with you.
Absolutely. Thank you so much. So with that, I'm going to go ahead and jump into our first question, which is, how should people evaluate whether to keep their employer or private insurance, transition to Medicare, or use both? And then how does the coordination of benefits work when people do have multiple insurance plans?
Sure. So that is a tough decision. It's really one of the first major forks in the road, I think, when it comes to coverage, and it can be a really overwhelming decision, whether to keep private insurance, drop it, for Medicare coverage, or try to pair them together. And really, I would answer that based on the size of the employer. There is something called coordination of benefits that Medicare uses to dictate who pays first. And it actually depends on the number of employees in the workplace. So for larger, what they consider larger employers, those are employers that have more than 20 employees. And if that's the case, the employer group policy will pay as primary and Medicare will pay secondary. So picking up any of those balances. So keeping both at that time is an advantage because Medicare, like I said, can help pick up those out-of-pocket balances that are less by your commercial plan. So for those smaller employers, so with any with less than 20 employees, Medicare will become primary, and then the employer plan is secondary. So can become a little bit confusing because if you actually don't enroll in Medicare Part A and B when you're eligible, then your employer plan actually has the right to refuse to pay for services. So you could end up with a lot of out-of-pocket costs. So really in that scenario, I would encourage you to reach out to whether it's your own employer or a spouse's employer to talk to them about how their plan works, if you're not quite as familiar, just so you can find out more of those nuances. And they also may be able to make a recommendation about when you should switch over. So when you're actually choosing, it's really important to look closely at out-of-pocket maximum for those plans. So that's going to be how much you will pay in a plan year, the total amount. And I would also encourage you to look at the formulary compared to Medicare's Part D plans. I know for MSA patients, the goal is really to minimize disruptions to any kind of specialized care. So you're going to want to double check what kind of providers are available through those networks and any kind of durable medical equipment coverage as well.
Awesome. Thank you for providing some clarity on that. Our next question is going to be, how can people bridge the insurance gap during the 2-year Medicare waiting period after qualifying for Social Security disability insurance? And what coverage options should they explore in that time period?
Sure. So I know MSA, and you probably heard from the Social Security representative earlier, MSA is recognized under the Social Security Compassionate Allowance Program, which thankfully does fast track the approval of your disability benefits. Unfortunately, it does not fast track that 24-month waiting period for Medicare. So currently only ALS and end-stage renal disease receive automatic Medicare approvals or the waiting period waiver. So like Ella said, that unfortunately leaves this 2-year insurance gap that you have to bridge. So my recommendation is to evaluate any kind of employer coverage that might be available through a spouse or partner. You can check and see if you're able to transition on to a spouse's employer-based plan. You might be eligible to a special enrollment period because you lost your employer-sponsored coverage. That's generally going to be the most stable coverage and the most cost-effective option. But there is also an option to look at the Affordable Care Act marketplace. SSDI does count as income, but you're no longer working, so your household income may be able to qualify you for some monthly costs there. So, and also, any kind of marketplace plan is not going to be able to deny you coverage or charge you more because of a pre-existing condition. There is also the opportunity to potentially screen for Medicaid. Medicaid is going to be an option for folks who are a little bit lower income. However, if your income and assets have dropped because of medical expenses or because you're no longer working, you may be eligible. So I recommend that you check your state's Medicaid eligibility rules. So that might actually be an option for coverage.
Awesome. Um, and obviously, as we're thinking about coverage, people with MSA need access to really specific care in order to manage symptoms. And so, how can people ensure that their Medicare coverage includes access to specialized MSA care centers, out of network providers, or major hospital systems? And kind of what should they look for when comparing those plans?
That's a great question. It really comes down to there's really a classic choice between original Medicare and potentially pairing that with a Medigap plan or seeking a Medicare Advantage plan. For a more rare, complex condition like MSA, those paths look very different. So original Medicare with a supplement is typically considered like the gold standard for folks who have rare diseases, simply because there are no networks. You are generally able to see any kind of specialist that you need to or visit hospital systems in the US, and that includes, movement disorder centers or any kind of specialized autonomic care that you might need. As long as that provider accepts Medicare, then you should have no problem seeking care there. There are no prior authorizations or anything like that for traditional Medicare or original Medicare. So there's no referrals or anything like that that are required. That is not necessarily the case with Medicare Advantage. Those plans are typically, they are Medicare coverage, but they are managed or administered by private insurers, and they do utilize networks. So you will see like a PPO plan or an HMO plan for a Medicare Advantage. So if you have a preferred specialist or like a center that you typically, center of excellence that you typically want to stay in, but it's out of network, a Medicare Advantage plan may not cover at all for you to go there. Or if they do, the costs are going to be much higher than they would be if you had original Medicare. And generally, Medicare Advantage plans rely on prior authorization a lot, which can unfortunately cause delays for therapies or, whatever kind of specialized equipment might be needed. So I would really just encourage you, if you are looking at a Medicare Advantage plan, which I know are attractive to a lot of people because they generally are cheaper, just look at the network directory closely and explicitly search for the specific providers that you're wanting to see before making any kind of formal decisions.
That's super helpful. Thank you. This next question is a little bit broad and may not be something that we necessarily have the time to go into crazy detail about, but just from a high level perspective, what services are typically covered by Medicare, Medicaid, or supplemental plans for people with progressive neurological diseases like MSA, specifically referring to things like home health, caregiving, communication devices, therapy, etc. And on the flip side of that, where are some gaps that maybe families need to plan for?
Absolutely. So you're right. I mean, that's a very broad question, but I think I can kind of put the answer into buckets, if that makes sense. So as far as what Medicare, Medicaid, and some supplemental plans will cover, generally they're going to cover durable medical equipment. So, hospital beds or wheelchairs, any kind of lift. Medicare will cover those generally about 80%. So if you do have coverage with original Medicare, you're going to be paying about 20% of that cost. But if you do have a supplemental plan like a Medigap, that will come in and help pick up that other 20% left. So Medicaid, typically, you're going to have a lot lower costs, if any. So if you have Medicare and Medicaid together, again, Medicaid is going to help cover those costs. As far as outpatient therapies, You're going to have coverage for physical therapy, occupational therapy, speech therapy. You will have coverage for things like speech generating devices or any kind of AC devices. That is considered a durable medical equipment. So if you do have, any kind of speech impairment as it relates to your diagnosis, that would be something that's covered. As far as any kind of home health care, you would have coverage for nursing at times and physical therapy at home or occupational therapy at home, but that's going to have to be ordered by a physician. So that's not going to be something that you could just like call up and ask somebody to come into your home. You'd have to be referred to that service or have a prescription for it. I mean, not a referral, just a prescription. Something that I do want to kind of flag is that there is no coverage under Medicare for any type of long-term or custodial care. So, if you did need help with things like eating or bathing or dressing, any of that 24/7 care that sometimes is needed, that is not going to be covered under Medicare. Medicare and Medigap will not pay for any kind of aid services to come into your home just for bathing and dressing and those kind of ADL activities. So families need to prepare to pay for that out of pocket or rely on other family caregivers or to plan for Medicaid eligibility.
Got it. That kind of provides a perfect segue into our next question, which is how does Medicaid work specifically for long-term care and home care needs, and when exactly should families begin planning for Medicaid eligibility?
So because Medicare leaves custodial care uncovered, Medicaid typically will become the default safety net for any kind of long-term care. Medicaid has two types of programs for long-term care coverage. So first is going to be what's called institutional Medicaid. So that's going to be care for in a nursing home setting. They also offer home and community-based waivers, which those aim to help patients stay in their homes. And Medicaid will pay for home health aides or home modifications that are needed to keep patients in their home safely. So it can be a little bit tricky because Medicaid is a federal program, but it is run by states. So states get to decide what the eligibility rules are. But as a general rule, Medicaid is designed for low-income individuals, but each state gets to decide sort of what the guidelines are in terms of assets and income thresholds that you have to meet in order to be eligible for the program. As far as when you should start planning for Medicaid eligibility, I would say as soon as possible, preferably the minute that you find out you have a progressive disease, simply because with long-term care Medicaid, there is a 5-year look-back period, and that does apply in almost every state. It's not a federal regulation, but almost every state does have that type of rule. So when you apply for Medicaid long-term care, the state is going to audit your financial records for the past 5 years to just make sure that you didn't give away any money or make a large gift of money or assets just to qualify for the program. So if they find out that you've transferred assets or your home incorrectly, sort of within that window, you may face a penalty or you may not be able to qualify for Medicaid. So I recommend working with an elder law attorney or a specialized healthcare advocate or caseworker early on in that process, just so they can help you protect your assets while also trying to maximize your eligibility for long-term care Medicaid.
Awesome. And still talking about long-term care planning and looking at that a little bit more generally, what long-term care options exist for people with MSA, and what are some of the financial considerations that families need to be thinking about as they're preparing for needs to increase over time?
Yeah, absolutely. So I understand that because MSA is a progressive disease, the care needs can sort of escalate rapidly. And I would say generally long-term care, you can kind of break it down into sort of three tiers. So I would say the first option would probably be kind of in-home care, whether that's covered through Medicaid or that's something that you pay for privately, maybe through an agency. Those folks are going to be helping with those day-to-day activities that I talked about earlier. So financially, that is going to be pretty demanding. That is going to be $25 to $35 an hour, I would say. And then if you need that for 8 hours a day, that really adds up quickly. So you're looking at probably, $6,000 to $8,000 a month for that private care. And again, I just want to make a caveat too that these are just general costs. So the cost in your area is going to vary. It varies by region or by location. So if you live in an area where cost of living is higher, generally your expenses for, this type of care would be increased. So I just want to kind of make that little caveat. So the second I would say is your skilled care. So your skilled nursing facility. So if you are unable to stay at home or can't, be at home safely, then you may need to transition to a long-term care facility. So normally those are going to range anywhere from like $8,500 to about $10,000 a month if you do not qualify for any kind of Medicaid coverage or if you don't have any kind of long-term care insurance available. And the third I would say would be a hospice care. Hospice care is covered fully under Medicare Part A. And when an MSA patient were to reach kind of the advanced stages of the disease and elect for more comfort care, Medicare would cover 100% of those hospice services. So all of your medications for any kind of symptom management, they would cover 100% of medical equipment, including hospital bed and that kind of thing, as well as they would cover visits from nurses, social workers, chaplains, and home health aides.
Awesome. Thank you. Our next question, we had some people ask about obviously caring for someone with MSA can take a lot of time. And so, are there programs that help pay family caregivers or provide caregiving support for people whose loved ones have significant disability?
So, unfortunately, there's not any kind of real federal program that I think that's every now and then we see in the news that there's a legislator who's trying to bring that about. But there are some state programs, and I would encourage you to look that up. It would be hard for me to call them out individually, but there are some state programs that allow for payment for family caregivers. There's also a Medicaid program that allows those home and community-based services waivers I was talking about earlier. A lot of those allow for what's called a self-directed option or participant-directed option, which allows the recipient of Medicare to essentially hire their own care staff. And that can sometimes include a spouse or a child as their official home care aide. So instead of that money going to an agency, that money would be paid directly back into your family. But again, that is not in every state. So I recommend if you are thinking about Medicaid coverage, just checking on that particular aspect in your state. There's also a program for folks who are wartime veterans or if you're a survivor of a wartime veteran called Aid in Attendance. That is through the VA. And that also is similar to the Medicaid program in that there's essentially a monthly pension that's given explicitly intended to help cover the costs of a caregiver, which can be a family member. And then, as I mentioned, there are some state run programs, but also there are some caregiver stipends that are available through like your local area agency on aging. So I would recommend looking up in your area as well to your your agency on aging, excuse me, to find out if your area has any kind of program like that.
Thank you. Yeah, that's super helpful. Obviously, when we talk about all of this, we know that the care needs for MSA patients can be really complicated and also can be pretty different from patient to patient. And so just more generally speaking, like what advocacy resources, case management programs, or patient navigation services are available to help people do things like manage doctors, prescriptions, insurance denials, etc.
Sure. So absolutely. I mean, it can seem really isolating or overwhelming to face a diagnosis like this and then feel like you have all these other things you're trying to manage as well. If you have issues with insurance or trying to figure out how to pay for all of the care that you need. So the first organization I would highlight would be Patient Advocate Foundation, where I work. We have a program that provides free case management. We help with things like insurance denials. We help if you have issues with paying for your prescriptions, we can help you look for programs to help cover those. We don't specifically recommend providers. We can't necessarily tell you if you are on the right treatment plan, or we can't choose your doctor for you or anything like that. But we can, if you have a barrier to care, like you can't figure out transportation back and forth to your provider or something like that, we can absolutely help you try to work on issues like that you're facing as a result of your diagnosis. Another organization I would kind of call out is your state health insurance assistance program. And this is actually for Medicare beneficiaries and their families. That program offers free, and I would say bipartisan's not the right word, but unbiased guidance one-on-one to help you choose the best Medicare plan, help you understand your benefits, help you with any billing issues. They are a great resource. And you can find, each state has their own. You can find yours just by Googling, like, Minnesota State Health Insurance Program. You can also type SHIP. SHIP is kind of the acronym for that program. I did just mention them, but your area agency on aging is a wonderful resource, regardless of the actual age of the patient. They are a great bridge to community resources, home delivered meals. A lot of agency on aging programs, handle the Meals on Wheels programs. They have caregiver support, and a lot of them also will help with Medicaid applications. So they are a wonderful resource. And then I would also call out folks like Mission MSA. I mean, they have brochures and videos and webinars and a peer support network that really help you kind of understand the medical nuances and just everything that comes with this specific journey that you're on.
Absolutely. Yeah, those are all great resources. Thank you. As we wrap up here, we just have one more question for you. And just from a more high level perspective, we would love for you to discuss what are some of the biggest insurance or benefit challenges that you see people with rare diseases like MSA facing, and what changes are being discussed to improve access to care.
So one of the things I would kind of call out as just an exhausting part of any kind of care journey is just the sheer volume of administrative hurdles that there are when it comes to health insurance. So many insurers rely on prior authorization. So, if you're unaware of what that is, it's when your provider prescribes a medication or a treatment or a procedure for you, and you essentially have to get permission from your insurance company, and they have to approve it before you will be before they will cover it. So it's such a sort of time suck, I would hate to say, and there's so much paperwork that goes into those kinds of utilization review hurdles that it often just delays access to therapy, custom wheelchairs, specific medications, and it can really be a barrier to getting the care that you need when you need it. There are a lot of good things happening too. So we saw with the Inflation Reduction Act of 2022, they redesigned Medicare Part D. So that's Medicare Part D is the prescription coverage part of Medicare. So they ended up putting a out-of-pocket maximum. So now for 2026, all Medicare plans have to cap their coverage at $2,100. So once a patient reaches paying $2,100 for the year for medications, they will not have to pay any more for the rest of the year. So that's a wonderful thing, because prior to that, Medicare had this whole donut hole coverage gap. It was really confusing. So that's been eliminated, thankfully, and there's a much more straightforward structure to Medicare prescription coverage now, which I think is definitely a step in the right direction. There's also the Medicare prescription payment plan that they implemented for the 2025 plan year, which has been a big help for a lot of people. It doesn't necessarily help you save money on prescriptions, but what it does is it allows you to spread your out-of-pocket costs evenly throughout the plan year. So instead of, going to the pharmacy counter and having this massive cost right at the beginning of the year, that will get spread out over the course of the year. So you're paying monthly installment versus being hit with a huge, huge bill, essentially, right at the beginning of the year. So there's also some legislation kind of floating around that I mentioned earlier, is to end the Medicare disability waiting period, to kind of eliminate that 2-year period for folks who have degenerative conditions. And I know that the rare disease community is really working on pushing that legislation and trying to coordinate their efforts on advocating for that legislation. So I'm hopeful that we're going to see that hopefully in the near future, and that's going to make access to Medicare a lot easier for folks like those of you that have MSA.
Awesome. Yeah, that's really helpful to understand. Thank you so much for being here with us today and for answering so many of the questions asked by our community. These things are obviously really difficult to navigate, and so we really appreciate you providing some clarity on some of it.
Yeah, absolutely. Thank you for having me.
Of course. Thanks.